Thank you. Wow. Very interesting stories we just heard. Very emotional and heart-touching, which I also relate to her because from the same country I'm coming. And also we heard from our other friend, Tony. Very interesting topic. So I think I'm done. Let's go home. Let's leaving. I'm just kidding. But one thing that you guys noticed that both of them talk also that what empowered everything, it was education too. I'm coming to that later. So, my name is Farhad Ziaee, and I have a BA in sociology with minor in psychology. Graduated last semester from California State University, East Bay in Hayward, with the highest honors. And I also worked for Contra Costa County as eligibility worker specialist for the past 5 years. And prior to that, I worked for United Nations organizations for almost 10 years. So today what I'm going to talk is why we should have tuition-free public college education and healthcare coverage for all Americans, and why healthcare coverage has a relationship with the higher education and financial outcomes. Well, I have to tell you that it is also becoming a personal story, so and I'll elaborate more on that. In fact, I finished my BA, almost took me 8 years to finish it. Not due to any inability to study or having problem with understanding. In fact, I finished my junior college also with the highest honors. But the fact, because of the high cost of the higher education, healthcare costs, full-time working, and family responsibilities. Obviously, you guys see this, two troublemakers sitting there. So this is they're just here, and actually it's the time that finalize my final exams and studying for that. But they have been supportive of me, it's my two kids. And so in fact, to come back to this, since my wife started going to college actually, we have already accumulated more than $40,000 in a student loan debt. And it keeps increasing. Some of it that we have to pay now and some of it we have to pay later after graduation. She goes to college for 5 days a week, more than 8 to 10 hours every day, taking 20 to 22 units every semester. She's my champion. She's right here sitting. I'm proud of her. So that's not it, actually. It's stressful, it's overwhelming, and both mentally, psychologically, and everything that you guys think of, right? It's hard, but that's not it. She also works. And the reason that she works, because we need to have health coverage for us. Without her employer-sponsored health insurance, we cannot afford to pay for the cost of the health coverage cost for us and for our two kids. So these are not a story of us only, but also a story of you guys sitting here as a student, some of you, and others that already graduated, struggling to pay for the cost of the healthcare coverage, public college education, tuition for themselves or for their kids. And that's both problematic and can lead us individually to financial crisis and also as an entire country. So here's why I'm saying that. So the student loan debt actually is the biggest one after the mortgages. In fact, the study shows that based on the statistics in 2018, the student loan debt actually is $1.4 trillion. Yes, with the T, trillion. So we have over 44 million US borrowers. And in fact, 20% of all debt comes from the state of New York, Florida, Texas, and California. And in fact, the student loan debt was rose by over $79 billion in 2018. And in the first quarter of 2018, we had, in fact, over $32 billion in delinquency rate, which means that people were not able to pay their debt for over 30 days. That's a huge issue, right? So when you see this chart, hopefully you guys can see it, in fact, this shows that the big chunk of this student loan debt is a millennial debt, which basically Americans from age of 18 to 30 becomes enslaved to financial institution through higher education costs and a student loan debt for life, right? So students, Americans actually not benefiting from this in many ways. First, that they actually take the student loan to pay for the high cost of the higher education. And then once they graduate, if they got lucky to have a better paying job, right, they will repay that money plus the interest. And if, for example, if they cannot find a better paying job, they will face the financial crisis and they will pay more interest, right? On the other hand, in fact, the Wall Street and financial institutions, they profit in every other ways. First, that they take that loan, sell it as securities in the stock market, benefiting from that, making money. Then when the students start paying it, well, plus the interest, so they make money. And in fact, if they cannot pay it on time, so they will increase the interest. And even a student cannot actually file bankruptcy if they cannot do it, right, repay it. Even a gambler or a corrupt organization, they can file bankruptcy, but not the students, right? That's a problem. And these financial institutions, they can snatch the money from your, based on the rules and regulations from your account, through your job, pay stubs, everything. So people remain for life enslaved to that system. So that's a big problem for all of us, for all Americans. And when we look at this also, it shows that the study shows that Americans or the students, that they have the highest student loan debt by the time they reach at the age of 30, they actually will not be able to fulfill the American dream that we all do, right? Home ownership, you cannot purchase it. That's another big problem too. And in fact, the study shows that the total overall cost of the higher education is $99,000. Out of which $17,000 actually paid by the parents, poor parents, right? And $80,000 actually remain as a financial burden on the students to tackle that. The study also shows that 62% of the parents actually, they reduced their leisure activities and or stopped it to just pay for the high cost of the higher education for their children or to pay for the student loan debt. And 74% of the parents actually, they just prefer their kids or their children to study computer programming degree rather than other ones, just because they will have less chance of having a better paying job to pay for the student loan debt. But that's a loss for students, right? Because they will lose the choice, the selection, what they love to study and what they love to work in the future. So that's another loss for the students. And worst of all, 85% of the students actually working while they are studying, which means that they, an average in a student, working 4.2 hours daily, which is double the time that they are studying at home, attending a class, or they're visiting a library to do research. So that's a big problem, which creates actually anxiety and psychological pressures on them because of their financial situations and also their academic performance. But that's not all, right? The second problem is the healthcare coverage cost. All of us need healthcare coverage. And that's a fundamental need for all of us. Especially for students, because it's required when you attend a college, you have to have that health insurance, otherwise you cannot attend it. So that's an additional financial burden on them. The good news was, and is, that Affordable Care actually reduced that pressure on students or many Americans, but not a lot. The way it works is that the Affordable Care allowed parents to keep their children under their plan up to age of 26, or if they have an income of student or the parents, if they have income of almost $1,300 or $1,400 or a little bit more, they can have the expanded program of Medi-Cal or Medicaid, which is for free. So that's good. Actually, as a credit for the Affordable Care Act, and I work for Contra Costa County as eligibility work, for the past 5 years, I have heard thousands of people, actually, that they had crying on the back of the phone, which they received Medicaid or medical for the first time as a health insurance, or they got health insurance for the first time, just because they were not able to get it because of the pre-existing condition, or the high cost of it, or a lot of deductibles, we name it, so we all know about it. But the point is that that's an additional problem for all the students too, for all Americans, but especially for students. And that's why. So the study shows that with the Affordable Care Act, actually the student loan debt was increased by 2%. There's no definitive answers, but there's two interpretations on that. First, that because of the families and the students, they were able to get health insurance through Medicaid or Medi-Cal, they were able to invest in more in higher education, which also led that the student loan debt increased. On the other hand, also because more parents and families or students, they were not able to get healthcare coverage just because they had a little bit more income, they end up settling for more student loan to pay for the high cost of the healthcare coverage, which also problematic. So these are the two interpretations of that, and that's reality. So in that case, we need to have this system to be corrected. But opponent of both ideas of having public college education and healthcare coverage system for all Americans, they have also their own say. Yes. So the first set about higher education, they're arguing that higher education is not for everyone because they may end up not paying their healthcare coverage costs or their student loan debt, right? Or the high cost of the public college tuition or any higher education. That is actually, it's just saying that higher education is not for everyone, is not fair. And here's why. We just heard, through higher education, we get to know our rights, our civil rights, our constitutional rights, and our human rights. And we become a better person as a citizen to serve in the community, right? With that idea that higher education is not for everyone, just because they will not be able to pay for the student loan debt or the tuition, it creates a second-class citizenship for a large portion of population of this country. That's not fair. On the other hand, for healthcare coverage, they argue that healthcare coverage is not needed unless when you need it sometimes. Well, do we need to have health insurance while we are in an emergency room with $100,000 or $1,000 of bills on our hand, sitting on a bed in a hospital? We don't. We need to have that as a guarantee. So how can we have that? Well, we need to have healthcare. We need to have both public college education and healthcare coverage as a right, not as a privilege. Look at the other countries, which they have half of the economy of us, like Canada. They're providing healthcare coverage for all their citizens, while their doctors and hospitals are still private. Look at Germany and other countries in Europe that they're providing college tuition free for all their citizens. We have the richest country. We are the richest country. Can we not do that? Yes, we can. Why we should wait till we become 65 years old or we have some kind of disability to have Medicare? We should have that from get-going. Similar to Medicare, we should have a healthcare coverage system from get-going, from the birth, without thinking about it, without any income brackets. I know that we have the news, it's very popular in these days that they are trying to repeal the whole thing, and that will lead additional 50 million people will lose their health insurance. It's becoming hot, right? So, these are the issue about healthcare coverage. But the good news is that the healthcare coverage for all has become very popular. The reader survey that you guys seeing that in fact 85% of the Democrats and 52% of the Republicans support this idea. Only 20% actually reject it, but we can reduce that number by starting this conversation. We can do that. So how do we do it actually? We can do it by restructuring government, by asking government to restructure their foreign policy funding system to other countries, while focusing, thank you, while focusing on domestic issues to invest on our education and healthcare coverage for all Americans. We don't need any funding for building a wall or anything, but for our main issue that we all suffer from. We also see that the recent tax cut did not help average Americans, but only millionaires and billionaires. We can have that tax on millionaires, billionaires to support the higher education system or healthcare coverage through payroll tax, thank you, or property tax. We also saw that in 2008, we bail out the Wall Street for no fault of us. Isn't it the time that the Congress need to find a way to tax them to support our higher education system so that they can pay their fair share? We bail out them. Or we can ask experts from other countries like Canada for healthcare coverage system or Germany for higher education system as experts, how they are doing it, how they are funding their system. But also, Americans, we are the innovators all. We can find a simpler way to how to fund both systems. But we cannot remain silent. We have to talk about it. We need to create a discourse. We have to think about it, at least for our sons and daughters and future generation. So what would be the outcome if we have it? Well, more people will be educated, and all Americans will have healthcare coverage as a guarantee, as a right. The students will have more time to study, right? And less time to think about financial problems, and they will have less pressure psychologically, physically. And that will lead to more innovations, more ideas, that we will have a bigger economy. More people will invest in more businesses. And we will have a lot of jobs. More jobs will be created. And we will have a highly educated workforce. We will not need to outsource our jobs. That is the biggest one. And in fact, the students will not have the student loan debt for life. And in total, it will be a better change in lives of all Americans. I will leave you with 3 questions. Are we willing to work towards preventing the next big financial crisis due to the student loan debt? Are we willing to prevent our sons and daughters or future generation to suffer from high cost of the higher education and healthcare coverage and a student loan debt for life? Are we willing to work towards creating a healthcare system that provides coverage to all Americans, irrespective of any health condition, pre-existing condition, age, and income brackets? The answer for me, I don't know. Unless we start talk about it. We create a discourse with the good heart, irrespective of our political principles and affiliation, to advocate for public college education and healthcare coverage for all Americans as a fundamental human rights. Thank you so much.